Hello and thanks for joining us on the Wellness segment. I am Perpetua Fasami Peter. As with adults, when babies and children develop an infection, their immune systems fight the invading culprit, whether it's bacteria, virus, or a fungus. But sometimes the immune system's response to an infection can spin out of control, leading to a life-threatening condition called sepsis. Sepsis occurs when the body's response to an already present infection gets out of hand, leading to severe inflammation throughout the body that in turn can cause tissue damage and organ failure. When organs begin to stop functioning, the body can enter a stage of sepsis called septic shock, and the threat of death is imminent. Joining us to shed more light on this is Dr. Ikechukwu Kongu, consultant pediatrician, University of Nigeria Teaching Hospital, Enugu. Thank you for joining us, Doctor.
Thank you very much.
All right, let's start from the very beginning. What is sepsis?
Okay, I can define it in two ways. I can define it if I'm defining it to my medical colleague, or if I'm talking to the average person on the street or my patient. So if I'm talking to my medical colleagues, I'll call it a systemic inflammatory response with an evidence of an infection or a focus of infection, or maybe an infection in which there is organ dysfunction. Or if I'm talking to the average person on the street, I'll just say it's an infection, a localized infection that has now gotten out of hand and involved the entire body, and that is quite that's quite serious.
Okay, doctor, in clear terms, help us understand the difference between sepsis and infection, because I remember there was a time I thought they were almost the same thing. Help us understand the difference, please.
Okay, an infection is, like I said, when it's still localized. So an infection is maybe you have a boil in your arm, you have a cough, means there's an infection in your throat, you have or let's say maybe an infection in your eye. Once there is an organism. But for sepsis is when the body usually tries to localize this infection. But when the body is unable to localize the infection and keep it, localized at where it is, maybe for example, pneumonia is a chest infection. So if for any reason the body cannot localize that pneumonia and it now becomes, generalized, affecting the entire body, that means the microorganisms have gone to the entire body, then that is what we call sepsis. And then it's usually worse when there is organ dysfunction. So the various organs of the body start shutting down. Your lungs are no longer functioning well, your liver is no longer functioning well. That's what we term sepsis. So it's no longer a localized thing, it's no longer like something that the body is containing. It's now generalized, now affecting the entire body, and that's what we call sepsis.
Bad. All right, now, since the cause of sepsis is already in the definition, tell us the risk factors.
Broadly defined, it could be if your immune system is not strong enough. So little children like neonates, newborn babies have that problem. So because their immune system has not become well developed, they can't contain an infection, and so it can become generalized. If you also have other immune disorders, maybe HIV, you're elderly, you can't contain an infection, that can also lead to sepsis. If you're not vaccinated, for example, we all know about COVID that is going on now. COVID can also lead to a sepsis, because if you're not vaccinated, then the infection can get a lot worse. It can now involve your entire body and now lead to a generalized sepsis. So these are like just looking at some various factors, some basic things that can lead to or predisposing factors. Then obviously, if your health-seeking behavior is very poor, if it starts out as maybe a cough and you don't do anything about it, you're taking local herbs and stuff like that. If you have a very poor health-seeking behavior, then it can now, blow out of proportion and become generalized and lead to a sepsis.
All right, we're focusing on sepsis in children now. And I remember earlier you talked about vaccination. Is there any vaccine that children can take against some of these infections? And what are these infections that, if not taken care of, could probably lead to sepsis?
I think virtually all infections in children can lead to sepsis, but there are some that are vaccinatable. Like when you give them the penta or the HIV, penta contains about five vaccines or five vaccines in one, and it contains things that can protect you against things like streptococcus pneumonia, encapsulated organisms. But generally, even if you don't immunize them against even other things like measles and TB and all that, the infection can now become so generalized that it now leads to an infection. There are some that are preventable. There are some like the pentavaccine that has other various constituents in it that can help prevent sepsis. So those are things that the usual vaccination schedule that we have in Nigeria can prevent most of the common illnesses that can now spiral ball out of control into sepsis.
All right, well, it is established that sometimes infections passed from mother to child can result in sepsis. And then we have this data that talks about the fact that up to 30% of pregnant women carrying group B strep, we have about 30% of women carrying it, and this can be passed to a baby during delivery. What can be done to prevent this?
Yeah, I think it's very straightforward. I mean, if you register in an antenatal center, in a very reasonable antenatal center, there are certain factors they will monitor. They are going to do a urine test. They are going to, if you have any discharge, they're going to, do swabs and things like that. So I think the first step is obviously very good antenatal care. Then the period when you're about to deliver, you have to be very careful. The doctors too be very careful. They want to find out if you have a fever, you have abdominal pain, you have discharge. These are all the indicators that you could be having an ongoing infection. And then finally, when the child is born, this is where the pediatricians come in. Once the child is born, we adequately monitor that child. If there are predisposing factors in the mother, maybe the mother had an infection, we start out antibiotics empirically. We don't wait for the child to break down before starting out antibiotics. Then if the child, while we are monitoring, if maybe, for example, we didn't pick up those symptoms in the mother, during the first 24, 48 hours, we usually monitor the children. Does the child have a fever? And if the child has a fever, we don't just wave it off. We start treating very aggressively. So if we want to prevent that, the transmission, first of all, we'll have to be starting from very good antenatal care. And then once the child is born, we can treat them empirically before the child breaks down with any kind of infection. So those are the steps for now that we currently take to prevent, this from happening.
And I think that's a very good one. I mean, you made a point there talking about the fact that the antenatal hospital should be well considered, not just anywhere. You should ensure you go to a place where you'll be well taken care of. Point noted. Now, what are the symptoms of sepsis in children?
Yeah, okay. For the doctor, what the mother is going to notice is that the child is sick. For the older child, if the child has a fever, I do a full blood count and I find certain that will show me abnormal white blood cell parameters. And things that will make me consider the fact that the child has a sepsis.
What about the full blood count?
Yeah, I said if I do that and the white blood cell count is abnormally high, then I'll be very concerned. If I see abnormal kind of neutrophils, I'll also be very, very concerned about that. So these are factors that make me think that this child has a sepsis. Then general clinical examination as well. If the child is very ill, if he has very small pulses, these are also factors I'll consider that this child has a sepsis.
Now, that's for you as a doctor. What about as a mother? What are the things you should look out for in your child? What are the symptoms?
Yeah, so looking at the investigation results, looking at the child that is right in front of me, I can make a clinical decision and say that this child, has a sepsis. So both the investigations that I'm going to carry out, a full blood count is the most important point. I can also do a blood culture that will make me feel that, when I get certain organisms, I can tell that this child has a sepsis. And then also, if I look at other systems, maybe the cardiovascular, how is the pulse volume? These are also markers I can tell that maybe the child is slipping into a more concerning aspect, which is septic shock, which is more concerning for the doctor.
All right, doctor, I quite understand you said a lot of things, but I'm saying as a mother, what are the symptoms you should look out for in your child?
You're not going to make the diagnosis of sepsis yourself. What you're just going to say is that my child is very sick. It's the doctor that's going to make that diagnosis. So if you feel that your child is very, very febrile, very sick, just come to the hospital first of all. You don't wait till it gets very, very bad. Just come to the hospital and then the doctor is not going to make that diagnosis. On your own, you can't make that diagnosis. You can't do a test in your house. The doctor has to do that himself. And, these are factors that the doctor has to do himself. It's not, for the mother to make that diagnosis. So if you feel that your child is very febrile, uh, not getting any better despite all the medications they are giving, then you have to bring that child to the hospital. That's why they always tell you, you treated for a few days and it's not getting better, just come to the hospital and the doctor can make that diagnosis.
All right, so how can we prevent sepsis in children?
Very good health seeking behavior. That's what I will always advise parents. Like I said, the mother cannot make that diagnosis. There is nowhere in the world where a mother will come to the hospital and say my child has sepsis. All you're going to tell me is that, okay, my child is not feeding well. I've treated for malaria, it's still getting worse. I've given antibiotics, it's still getting worse. So the only way to prevent this is very good health behavior. Don't wait. All you just need is 2 days. If it's for a very small child in neonate, don't even wait. I said prevention is very good health seeking behavior. Don't wait till it gets bad. If you've treated for malaria and it's still getting worse, just come to the hospital. If the child has a diarrhea and is not tolerating your ORS, just come to the hospital. We'll set up an IV feed. So don't wait till it gets very bad. Very good health seeking behavior. For little children, at most 2 days, come to the hospital. Don't treat for long at home. And you are asking about the complications, right? Yeah, the most life-threatening complication is the septic shock, and that's when the cardiovascular system shuts down. Because the body is now so overwhelmed, the heart is no longer pumping blood effectively well. So when you touch your child, I don't know if you know the pulses of your child. You can touch maybe the arm of your child or the neck, and you feel the heart beating. You don't feel that anymore. That means that the child is actually passing out. That's one of the greatest concerns that we have. Is an international problem. It's called septic shock, and once you delay, it can actually progress to that, because what happens is that the blood vessels dilate, and then the heart is now pumping against, is now pumping fluid into a place that is so dilated, and so the blood is not getting to the end organ. So the liver is not getting enough blood, The feet is not getting enough blood. The brain is not getting enough blood. The child now becomes unconscious. So that is very, very life threatening. That's the major complication that we have. And how doctors treat it is that they have to start giving your child a lot of fluids, and then also start out some medications that will help the heart contract and the blood vessels constrict, so that the blood can get around, the body system. But like I said, that's something that we have to manage. So once you notice that, your child is getting worse, it's now becoming unresponsive, you can't feel the heart beating very well, just come to the hospital, and then the doctors have to now, take over the other aspect of it. So the best thing that any parent can do is just very good health seeking behavior. Please don't wait till your child is bad. If you've treated for 1, 2, 3 days, just come to the hospital and let.
All right, doctor, thank you so much for your thoughts on this one. I do not know if there is anything you'd like to share with us, mothers and fathers, yes, not only mothers.
Like I said, the most important thing, like I said, is very good health seeking behavior, because I work in a hospital, and we have this thing of parents saying, I went to a pharmacy, they mix medications for me, and then by the time they come, it's very, very bad already. So as much as possible, parents, especially fathers, I'm a father, but I have to also talk to my own men. Men are always like, I beg, nothing is happening. You women, you have come with your wala again. Sometimes just listening to what they are saying, I know they can be crazy at times, but they have a penchant for picking out infections, and sometimes they'll be wrong. I know.
Absolutely. So whether we are wrong or not, listen to us. Thank you for coming on the show, Dr. Okongu.
Yeah, sure. You're welcome. Thank you so much.
All right. Well, you heard it from Dr. Okongu. Have a very good health seeking behavior. Thanks for watching. I am Perpetua Fasami Peter.